Hi, you're with Danielle and Laura Lee today from One Family Pediatrics, and we are here to talk with you about dysphoric milk ejection reflex, which is also sometimes abbreviated and called D-MER. And Laura Lee, can you tell us a little bit about your credentials and what you do here at One Family Peds?
I am the nurse manager. I'm an LPN and a mother of 5.
Ooh, that's a lot of kids. You must have a lot of breastfeeding experience.
Yes.
And can you tell us what dysphoric milk ejection reflex is, what the symptoms are?
Well, really it's just this, I don't know, a very difficult and awful feeling when your milk's letting down. So you feel that stinging sensation or that prickly sensation, but right before you feel that, you kind of feel this sadness or just this, it just was like a soul-sucking feeling almost. Like, I can't really describe it in words, but it's overwhelming.
And so is this something that you've experienced with all 5 of your children?
Yes. I did not realize it until I had my baby in October that that's what was happening. So I really thought I just didn't like breastfeeding, and then I thought maybe I was having terrible postpartum depression, and on it went. And so every time I had a baby, I got to the point where I dreaded the idea of nursing my babies, and I would cry or I would sit and be very upset and very tense during nursing, and it just was awful. And then with my last baby, Rory, who was 7 months old, when I was about 4 weeks postpartum, I started noticing the pattern, and it was a little easier to pay attention that right before my milk let down, I would feel awful, and I would want to cry, and I'd feel like life was terrible, and it would only last for a minute, maybe a little bit less, and then I would start to nurse her, and it would feel okay, and I'd feel kind of normal again. But I got to the point where I was dreading nursing, and then I'd get stressed out, and then my milk wouldn't let down, and it just, this unending cycle was beginning.
A vicious unending cycle. So what kind of treatment options are available? Because I know you're still nursing your baby, and it's a better experience now. So what kind of treatment options are available for this condition?
Well, it depends on what you and your practitioner decide. We tried Sudafed, which was one of the things that they said you could try to help with the symptoms. It didn't really help for me, but I have read that it helps for a lot of moms. Okay. So if you don't have the ability to go see your doctor or don't really know how to explain it to your doctor, there is information online about it. But I ended up going a little further and talking to my doctor about that, and also about postpartum depression, and so I'm on Zoloft, and that has helped a lot. I can still feel it sometimes, but it's not every single time, and it's definitely not as severe.
Okay, and so Zoloft is an SSRI, a selective serotonin reuptake inhibitor, and those have been proven safe for use in breastfeeding women. They've been proven safe for use in pregnant women. How did you decide that Zoloft was the one you were going to try first? Is that just what your healthcare provider suggested, or had you used it before?
I've used Zoloft before with like end stages of postpartum depression with my other children, so I knew that it would help with that part of things. And really, I still went into this thinking we're treating postpartum depression, and it took a while to really understand that my postpartum depression was probably triggered because of the D-MER. So, okay. So I felt like the Zoloft might work to do that, but it's also one of the recommended treatments. So it's kind of a starting point.
So for a mom maybe who has a history of depression and is experiencing these symptoms, what do you think is a good way to start this conversation with your healthcare practitioner, especially because this is a fairly unknown, not well published condition? What were the first steps that you took?
First I spoke to my child's pediatrician, and we just kind of talked about it to see if this was something that actually was affecting me. And then once I kind of got a little bit of reassurance that I was experiencing, D-MER and not just postpartum depression, I contacted my OB's office, and I spoke to the nurse. And I just described the symptoms that I was having. And, I just said, look, every time I sit down to nurse, I really feel like I don't ever want to get out of this chair again. I'm never going to be happy again. And then after I'm done nursing, it's mostly done, but it keeps happening and it's making it difficult for me to function. And then they recommended, we try some things, and so that's kind of what we did.
This is really amazing information. I know that there are moms that experience symptoms like this and maybe they feel guilty or nervous, or that maybe there's something wrong with them, like they're not bonding with their baby, and that it's a personal problem. But this is really a medical condition that is newly researched, right? So we really want to share with women that, this is outside the realm of normal. There is treatment, and it's not an active, willful choice, right?
Oh, no.
This is an actual medical condition, and we deserve medicine, right? Thank you so much for being here today to talk with us about this, because I think it's hard for women to discuss when breastfeeding doesn't go well, and when it's not just a physical thing, right? We can easily discuss poor weight gain, right? That's kind of sometimes a more external issue, and sometimes these internal issues can feel really confusing, I think. So what are there any peer support things that you have utilized to help deal with the condition? Have you met other moms that have talked to you about this?
I haven't met any other moms personally, but I have posted about it so I have a mom group that I used to be a part of that was online for a long time, and now we just have this Facebook page. So I have posted about it just to say, hey guys, this is what's happening. And, of course, all the moms immediately step in and remind you, you're doing the best you can for your baby, and it's okay, and, you do what you have to do for your family and that sort of thing. But also, it was just about creating awareness for me. Like, I had never heard of it, and I went through 4 pregnancies and 4 deliveries and nursing 4 babies, thinking that there was something wrong with me because I didn't enjoy nursing my baby and I didn't feel connected to my baby when I was nursing. And so I just really wanted to point it out to other moms and say, hey, if this is happening, or if you feel something like this, it's a real thing, and it's not you. It's just something going on with your body that you can take care of. So
that's amazing. So you can find out more information. You can follow us on Facebook, Oasis Lactation Services. You can visit One Family Pediatrics at onefamilypediatrics.com. And if you have questions about medications, please contact your lactation consultant or your pediatrician. And we really want to see you get treated if this is a condition you have. So thanks for watching today.